Welcome to CareTalk, your friendly home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, it's nice to see you down in town in country Florida. I hope I can swing by and visit at one of these points in time.
It's an undisclosed location. You'll never find it.
Very good. John, we have some serious topics today. Let's start on with why is the U.S. leaving the World Health Organization, and what are the implications of that?
Well, I think we're in sort of a should I stay or should I go? I mean, it's the classic White House shuffle around international institutions. Look, the W.H.O, the World Health Organization, was set up because of the absolute need for us to collaborate across border to solve healthcare problems that are cross-border, Ebola, pandemics, major illnesses. They monitor, it's some of the best science in the world, some of the best health in the world, and they're there to help the world sort out world problems. The president says he wants to leave. He doesn't particularly like international institutions. It's an election year. He's trying to blame China. He's trying to draw attention away from himself. But it would be nuts for us to leave the WHO, even acknowledging that they've been soft on criticizing China. I would think also they've been pretty soft on criticizing the U.S. What do you think?
Well, John, you're right. I mean, they're in a tough spot as an international organization. To be fair to them, of course, they might have moved faster, but they've moved faster than national governments have. They called the pandemic early on. They warned Trump and the administration repeatedly. They had tests available that worked.
And their tests worked. Yeah, their tests worked, unlike his CDC's.
So I think, what's happening is very much what you're saying. You have an organization that served the U.S. well, like NATO would be another example, and it's just instinctive, just like pull away. It's not building, it's just knocking something down. It's ultimately a self-destructive approach. And I think anybody who's involved in healthcare knows that we need to be part of the WHO.
Yeah, the dangerous part, David, is by pulling out, we slow down our ability to actually build a coalition around a global vaccine, solve the next pandemic, and it creates walls versus bridges with, honestly, health authorities that we need. So I think it's a crazy idea.
Yeah,
I suspect it's going to be a shuffle to the right where we might and then partially leave and then stay in, because from a scientific and frankly from a public health national security standpoint, we need the WHO as much as they need us.
Yeah, absolutely, John. I mean, I think you can see what's happening now with all the attention to COVID-19. There's some other things lurking out there like Ebola and measles that already see it in the Democratic Republic of Congo that are starting. And there's no guarantee that Ebola won't make it over here, for example. Well, on that cheery note, so how are we doing, John, on the pandemic in the U.S.? Are the cases going up? Are they going down? Are they going sideways? What's happening?
Well, why don't we ask the WHO? And the answer would be, we don't know.
Yeah, why not?
It looks like the global numbers are going down in the U.S. We're testing more people. We're finding more of it. But if you look at the absolute rate of increase, and certainly the hospitalization and death count in the areas that have been hardest hit, like the Northeast or the area around Kirkland, Washington, the numbers are down. But you're seeing a creeping increase in some of those red states that didn't close completely and they're opening pretty fast, like Alabama. So I think we've got to just monitor this. One of the challenging thing for our quick take culture is you want to be able to measure quickly and know immediately. And that's just not the way this virus rolls. What's your perspective? I mean, do you think we're through the woods on this one?
Well, John, clearly, we're not here in Massachusetts. Things are flattening out, slowing down. But I think that we can be hopeful that warmer weather, humid weather might help with some of the outbreaks. But you've also got to say, changes in places like you mentioned, Alabama, South Carolina, that have opened up fast. The cases have gone up. New cases have gone up more than 35% in the last week. And then if you look at the protests, the challenge there is that you have crowds coming together, right. And then if you fire tear gas and pepper spray at people, they're going to cough and sneeze by design, and that's just the vector for increasing illness. We'll know in a couple of weeks.
Yeah, I think the way to think about this, David, is we need to come up with solutions like testing at a mass level at low cost and tracing. The countries that have done that have taken even this wave of the pandemic down. but at least I'm of a mind that we need to be thinking about how we open our economy and in the context of a rolling pandemic, and that will put us in the strongest position to kind of recover. Because I don't see that we're going to get out of this, and I do anticipate, if you listen to the scientists, that the fall will be as we go into flu season, another potentially dangerous step back towards where we were. So, but we now know a lot. We should be able to manage this.
Yeah. John, I was just alluding to the protests, and certainly everyone, has their word about, George Floyd's death at the hands of police in Minneapolis. I think probably our niche there is about understanding some of the disparities, that are contributing here in the healthcare sector. Anything you want to say about, how we should look at this in the broader healthcare context?
Well, I think let's start with the fact that no one should be willing to tolerate murder at the hands of an officer of the law, and what we're seeing is unacceptable, and it's all of the deaths, not just George Floyd, but all the other recent deaths, and any deaths, the taking of an innocent because of anger or prejudice has got to be prosecuted. But the global response here, and you're right, it's very dangerous in the context of a pandemic, that there's just too much inequity. One great example of that is healthcare, where people of color don't have as much access. From an educational background, they still are less likely to be treated correctly and less likely to get access to the best care. And so even if you solve for income and educational background and geography, people of color are still getting discriminated against in conscious and unconscious ways in our healthcare system, which leads to not just diseases of chronically bad behavior that kill people of color at an early age, but the fact that there's a structural lack of access for the poor that disproportionately affects people of color, and there's a structural lack of guidance and support and sort of seeing people of color as equal to those who are white. And I think that has shown up in the statistics for years. And we've not, even from a healthcare perspective, made lots of great progress. We have the most expensive healthcare in the world. We invest more in it than any other country per capita. We should address healthcare inequities for people of color right now, and that would be constructive, and it needs to get on the agenda.
John, even before any statistics came in, it was no surprise to me, and I would have bet serious money that this illness was affecting people of color more than others, and sure enough, it is. And it's the CDC actually has a very good analysis of this on its website, which will probably be taken down if somebody from the administration hears our podcast and reads this. They outline 4 things, all based on the research that contribute to a higher burden of illness in the minority communities. Living conditions, like being more densely populated, multi-generational, or in prison. The second is work circumstances. When you talk about these frontline workers, critical, necessary workers, a lot of them are Black and brown people, and who don't have paid sick leave either. Underlying health conditions, chronic conditions, some of it actually caused by additional stress in life from some of the things, including how people are treated at the hands of police, and then lower access to care, much more, lack of insurance and so on.
Yeah, and what we really have to be careful of is the voices that are blaming the victim. If you're a hardworking person of color and you don't have a car, but you rely on public transportation, you are far more likely to get sick from this illness. If you don't have access to a doctor, or when you have access, they're less likely to take you seriously. If you're more likely to be an essential worker, which is many of those essential workers are low paid, in fact, paid minimum wage or just above minimum wage, which is from our perspective, barely a livable wage, you are going to be much more likely to get sick. And we have to deal with these structural inequities. If we do deal with them, not only will fewer people of color get sick, but our entire society will be healthier. But I think there are these embedded challenges that the riots have called out And if we shouldn't just have a pop-up passion of the moment. We've got to have a long-term change. I mean, there's a wonderful phrase by Max Weber where he talks about politics is the slow and hard boring through hard boards, and it takes passion and perspective. And it's only if you reach for the impossible that you get to the possible. We can solve these problems. They just have to stay on the agenda long after the riots change, the marches are over, and the mess is cleaned up.
Well, John, a mess there is, and we've been talking about multiple aspects of it, from the very truly global, from the WHO side, to what's happening across the country with the pandemic, and then specific issues of racism and how that ties down to individuals. And would love to say we'd have a happier outcome here. I do think that your idea about hard work over a sustained period of time is what's needed. That's what we're going to need to do to address all of these issues. And let's lead the way and encourage others to do it.
Absolutely.
John, let's wrap up this edition of Care Talk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening.
Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.